Pregnancy-induced hypertension. Pregnancy-induced hypertension. We already said that hypertension is as a result of what? The pregnancy. Okay. We spoke about the types. Okay. So the types. Gestational hypertension. So, gestational hypertension, here we can see that it refers to hypertension, okay? Hypertension in pregnancy after 20, okay? So, hypertension pregnancy after 20 weeks of gestation. So here, the onset of hypertension is after 20 weeks of 20 weeks of gestation. Hypertension in pregnancy after 20 weeks of gestation. And you should take note that the onset of hypertension is, it's occurring for the first time. The hypertension is occurring for the first time in pregnancy. Are we getting that? Are we getting that? That is when it's occurring for the first time in the pregnancy. So you are seeing a rise in the BPs beyond the threshold for the first time in pregnancy after 20 weeks. That becomes gestational hypertension. And for the gestational hypertension, it does not come with what? Proteinuria. Are we getting that? In gestational hypertension, there is no proteinuria. There is no proteinuria. It's not associated with, it is not associated with proteinuria. Is that clear to you? So because of that, we can also rename this as gestational non-proteinuric hypertension. Gestational non-proteinuric hypertension. Why? Because in gestational hypertension, there is no proteinuria. Should you do a urine dipstick or should you do a urine ARI, you will not see proteins. Are we clear? Please, are we clear? Now, the next thing we're talking about is pre-eclampsia. So in that case, pre-eclampsia, this is where we are going to pay so much attention to. Okay, pre-eclampsia. We'll define a pre-eclampsia. Then after that, we'll talk about the types of pre-eclampsia. Then we'll follow it up with the risk factors of pre-eclampsia using the 2019 National Institute of Health and Care Excellence. That's a nice. Then following that, we'll talk about the etiopathogenesis or pathophysiology of pre-eclampsia with several suggested mechanisms. Okay, and when we are done with that, we would focus on the types again, like what we will delve into the types. Okay, so you should know that pre-eclampsia, it does not only have to do with what the fetus or the uterus. It goes beyond that. It can affect a lot of systems in the mother and also in the fetus. Okay, so when we say pre-eclampsia, we can define it as a multi-systemic progressive disorder. A multi-systemic progressive, it means that for pre-eclampsia, it only moves forward. It doesn't go forward and come back. So if you are going to make a diagnosis of pre-eclampsia, if you make a diagnosis of pre-eclampsia, for example, mild pre-eclampsia or pre-eclampsia with mild features, and after some time the diagnosis changes to severe pre-eclampsia or pre-eclampsia with severe features, you should not be surprised. But if you have a diagnosis of severe pre-eclampsia or pre-eclampsia with severe features, and all of a sudden you are seeing that the diagnosis is changing to, somebody is changing the diagnosis to mild pre-eclampsia or pre-eclampsia with mild features, you should be worried. Because pre-eclampsia only moves forward. It doesn't go back. Are we getting that? It moves forward. It doesn't retrogress. Forward ever. Characterized by hypertension. Hypertension, we can put into bracket onset after 20 weeks of gestation. Characterized by hypertension with its onset greater than 20 weeks of gestation. And proteinuria. And proteinuria. And proteinuria. And proteinuria. So meaning that pre-eclampsia progresses in stages, okay? It progresses in stages. It can start mildly, then it will become severe, then it will start showing you signs and symptoms that if anything is not done, eclampsia will be imminent. Seizures will be imminent. Then if nothing is done, it goes into eclampsia. Are we getting that? Okay, it goes into eclampsia. And eclampsia is more like a complication of pre-eclampsia. If pre-eclampsia is not managed adequately or timely, okay, then you need to move to eclampsia, okay? Okay. Now, you should know that pre-eclampsia, as we said, multisystemic progressive disorder. It means that it will be causing damages where? In various systems. The uterus or the uteroplacental unit, uteroplacental circulation, it will have problems. The kidneys, it will have problems. The liver, it will have problems. The brain will have problems. A lot of systems will have problems. Even the heart may have problems. Please, are you getting that? Okay. Now, let's move on. Let's talk about the risk factors of pre-eclampsia. Risk factors. Risk factors. After risk factor, we'll talk about the etiopathogenesis. Then we'll look at the clinical types. Then we'll carry on from there. Initially, pre-eclampsia was, more of a triad where you have hypertension, proteinuria, and edema. But even in pregnancy, normal pregnancy, there's edema. Because of that, the edema has been what? Removed. It's not a must for the edema to be there. Is that clear? Okay. Let's talk about the risk factors. Risk factors. The risk factor, we are going to use the NICE 2019 guidelines, okay? NICE. NICE stands for National Institute for Health and Care Excellence, okay? We've seen this is standard, it's used a lot. National Institute for Health and Care Excellence. It's used a lot, okay? So we are going to be using these guidelines for the risk factors. The risk factors proposed by what? These guidelines. The 2019 NICE guidelines. Okay. Now, the 2019 NICE, the NICE 2019 guidelines. Okay. It classified the risk factors into two categories. Okay. That is, we have the severe risk factors or high risk factors. Severe risk factors, or we can even say that the high risk factors. Okay. Then we also have the moderate risk factors. Moderate risk factors. Moderate risk factors. So with the severe risk factors, we'll think of one. History of hypertension. History of hypertension during previous pregnancies. During previous pregnancy. So if there's history of hypertension in the past pregnancy, it is a high or severe risk factor for the next pregnancy in case of pre-eclampsia. Please, do we get that? Okay. The next one, I'm talking about maternal disease. For the maternal disease, we will think of one, chronic kidney disease. 2, autoimmune disease. 3, diabetes mellitus. 4, chronic hypertension. So in that case, chronic hypertension, of course, is a severe risk factor for preeclampsia. So in that case, how would the diagnosis be termed?
Chronic hypertension with superimposed preeclampsia.
Yes, so chronic hypertension superimposed by what? Preeclampsia. Is that clear? So these are the severe risk factors or the high risk factors for preeclampsia. Please, are we clear on that? All right, let's go to the moderate risk factors. For the moderate risk factors, we'll talk about family history of preeclampsia. Yes, they said if there's preeclampsia in the family, definitely it could occur in a member of the family who has gotten pregnant, but it's a moderate risk factor. Okay. Then again, the next one, if you look at the BMI of the patient, if it is greater than or equal to 35 kilograms per meter square, then it's also another moderate risk factor. BMI of greater than or equal to 35 kilograms per meter square. Raymond, how will you classify that? Specifically? Yes, Diamond.
Obese class 2.
Excellent. So it's obesity class 2. Please take note of that. When we are talking about BMI, what's the normal BMI, Kelvin?
19.
Normal BMI is what?
19 kilograms.
No, that is not true. It's not 19. Francis, normal BMI. Please silence so that I can hear clearly. Go ahead.
29.
That's not true. Clifford.
18.5 kilograms per meter square to 24.9 kilograms.
Excellent. That is correct. So it's 18.5 to 24.9 kilogram per meter square. When do we say the patient is overweight? Yes, Fred.
From 25 to 29.9 kilograms per meter square.
That is correct. So from 25 to 29.9 kilogram per meter square, we will say that the patient is what? Overweight. Is that clear? But when do we say the patient is obese?
When the BMI is greater than or equal to 30 kilograms per meter square.
Well done. That is correct. 30 kilogram per meter square become a threshold. Then we can classify again the obesity in stages. Jemima, when do we say it's class 1 obesity?
Class 1 is 30 kilograms per meter square to 34.9 kilograms per meter square.
Well done. That is correct. Eugenia, when do we say it's class 2 obesity?
So class 2 obesity is when the BMI is more than 40.
Class 2 obesity
35 down per meter square.
to
40.
specifically.
39.
Speak out. 39 what?
0.9.
What?
Kilograms per meter square.
So you should not allow me to be giving you the push. You should come freely. Okay, it should be more of a free radical or free oxygen species. Then we can say that you are more like a toxin. You can cause damage to endothelial tissues. Is that not it? Causing damage. The endothelial tissues and the endothelial surfaces will become more like the exams that you are going to write. Okay, then you cause damage to them. And if you cause damage to them, then platelets activation and aggregation is prone. It will become prone. It will happen. Is that not it? Causing what they call consumption of what? Platelets. And in that case, it will lead to low platelets. And if in the case of hypertension, as we are saying, the liver enzymes will become deranged. And also coagulation factors, as you know, platelets is decreased, high tendencies of what? Hemolysis. And if you have hemolysis with elevated enzymes and low platelet, how do you call that?
HELP syndrome.
Excellent, HELP syndrome. That is correct. That is correct. Yes.
Over 40 kilograms per meter square, that would be morbidly obese.
Greater than or equal to 40 kilogram per meter square is termed as what? Morbid obesity or morbidly obese. But 35 to 39.9 kilogram per meter square, it will be considered as class 2 obesity. Please, let's know very well. Yes. You say? Morbid obesity is when you have a BMI greater than or equal to 40 kilogram per meter square. Okay? But we say class 2 obesity, BMI greater than, basically ranging from 35 to 39.9 kilogram per meter square. But if you have a BMI, diamond, if you have a BMI less than 18.5 kilogram per meter square, how do you call that? Underweight. Excellent. That's underweight. Please, we should know the BMI very important. It's very, very important because in obstetrics you realize that BMI would be playing a role. Even when we were talking about diabetes, you saw we made mention of what? Metabolic syndrome. And again, BMI played a role. Okay? So it's very important. So it's BMI, so that will be obesity class 2. Okay? Then the next one, advanced maternal age. And here, what age are we going to be focusing on? Unfortunately, 35. It's greater than 35, but specifically, we want to be specific. It should be greater than or equal to what? 40 years, okay? If you have a woman who is 40 years and above getting pregnant, yes, she is likely to predispose to pre-eclampsia. The next one, if a woman has not given birth before, nulliparity. If a woman has a multifetal gestation, what's multifetal pregnancy? What's another name for multifetal pregnancy? Excellent. So multifetal pregnancy is the same as what? Multiple gestation. Please, are we clear? Then, another thing we can think of is pregnancy interval greater than 10 years. So if you deliver your first child, the patient deliver the first child, and the next child is coming after more than 10 years, then that pregnancy is likely to develop pre-eclampsia. Is that clear? Is that clear to you? So these are the risk factors for pre-eclampsia according to the 2019 National Institute for Health and Care Excellence. Is that clear? All right, let's move ahead. Yes.
So these are the same as the major and minor.
Excellent, that's correct. So it's more like the major and the minor. Okay. Now let's move ahead. The next thing we're looking at is etiopathogenesis. I think last time we were having a conversation on that, but I said don't worry. When we get here, we'll talk about it.